So we did a very robust herbal protocol with her, and she was able to resolve that infection.
Is it safe and possible to treat a UTI without antibiotics?
Yes, it is. It is most certainly. Herbs have the ability to eradicate some of these urinary pathogens, especially in an acute, um, not necessarily a chronic case. Very good success with using the appropriate herbs at the appropriate dosages and for the right duration. Unfortunately, when we have patients that are recurrent cases, it, of course, as we see amongst all the therapies, they start to lose effectiveness. And then for those patients that are experiencing chronic, it doesn't mean to say that it's still not a viable treatment option, but it becomes more difficult to treat those patients. And that's likely because our chronic urinary tract patients are more of a multifactorial patient, right? They have potentially chronic inflammation, their hormones are not in a good state, right? We have to look at their whole picture, their immune system. So that's something that it is, again, it's going to depend on the patient. But I know another question was treating a UTI during pregnancy. And unfortunately, that's something that will need to be treated with an antibiotic. We have robust research that indicates that there is a risk of miscarriage with any sort of infection in the pelvic region. So even if we detect an infection, but a patient doesn't have symptoms, we would still advise that the appropriate treatment include that. So what we do in those situations is we move more towards prevention. Once that infection has occurred, then we start out as robust of a prevention strategy as we can in order to prevent the need for antibiotics during the pregnancy going forward.
Okay, that makes sense. Can you share an example of a patient who has been able to get well from a chronic UTI using non-antibiotic methods?
Yes. Well, a lot of my patients come to me having already done multiple rounds of antibiotics, and that's not solving the issue. So and a good example, I had a patient who had done a few rounds, 3 rounds of antibiotics. She was an MS patient, and she unfortunately had not gotten better. Her quality of life was extremely poor at the time. And we with her, it was that typical story of she stopped culturing. She started to be, they started to be concerned about bladder pain syndrome, which is what we call IC here now in Canada. And however, when I looked at her labs, it was very clear that she still had that infection going on, and the cultures were just missing the infection, the most recent cultures. So we did a very robust herbal protocol with her, and as well as supporting, again, those other individual facets that were likely not well supported. Her vitamin D was very, very low on testing, and she was able to resolve that infection and get back to a much better quality of life. We did some bladder healing for a couple of months afterwards, and she has stayed infection free since the spring so far. She would be one case than a yeah. And I mean, I have so many cases where it's a similar story. Yeah, and some patients are good with follow-up and some aren't, and I'll check in with someone maybe months later and I'll say, how did that herbal treatment work? And oh yeah, I'm so much better. But that's not to say that it's one or the other. You can take pharmaceuticals, you can take antibiotics and do herbs. We actually do have some research that shows that taking garlic extract, for example, with macrobid actually enhances the effect overall, and people have a better chance of becoming symptom-free at the end of treatment. So there's things like that as well. Yeah, I have some patients. Yeah, there's so much. So there's so many different scenarios. I had one patient who had a C-section, so the catheter, and she developed symptoms, that low grade urinary urgency and frequency and burning, not not extremely severe, but no culture was showing positive, nothing was showing up. But we expected that it was likely something she picked up on the catheter, and we started a herbal regime that was targeted. I believe we did do microgen at that point, and she had enterococcus, and she was able to get 90% better. And here in Canada, we unfortunately do wait a long time to see a specialist. And by the time she got into the specialist, he decided to prescribe an antibiotic, low dose, for a month. And she wanted to pursue that therapy, which is absolutely fine. She wanted to become, symptom free, like we all do. And she achieved that. And a year later, again, so I checked in with her and she had still remained symptom free.
Oh,
So sometimes
great.
it's a combo, and sometimes it's just herbals. So it all depends. It really depends.
Yeah, it's really good to hear stories of success like that, because one of the things that often happens is that when people get well, like they do when they leave as patients and don't check in again, they leave the groups online. So nobody gets to hear the stories from the people that got well and left. And it's really important to know that it is possible to recover.
I'm someone who has recovered as well, right? So a lot of my practice is supporting patients and giving them that hope that they can get better. I had a decade of recurrent urinary tract infections, and then developed a particularly bad one that wasn't culturing, was then termed IC. This is back in 2013. And it took me a year to get better, but I only used natural medicine. I was lucky enough to be at school, so I had lots of professors and resources to utilize. Very helpful. And I know that healing is possible, and it doesn't necessarily mean that there aren't small relapses, but as you learn what maintains the health of your body, then it empowers you to be able to manage yourself, with sometimes very minimal intervention in order to keep yourself well.
I think gaining back a feeling of control is really important in that situation, and understanding what's happening and knowing that you have options if you do have a relapse are really important.
Exactly. Yeah. And everybody's recipe for what helps them get well is different. And I'm sure your community knows that quite well.
We try to make that obvious, I think, because everyone that we hear from that has recovered has a different story of how they got there. So it's very clear amongst our own community that it is different for everybody.
Yes. And that's why I like to stay within the communities. I'm not one of those people that have left, because I see new things coming up all the time, how an individual was able to get better. And I really look at that and see, what's the potential? Why was that particular combination, the combo that healed that patient? So it's important for practitioners to keep learning and to keep gathering more treatment options, because we
definitely agree.
Not every treatment works for every patient.
That is for sure. There was a question before we move on to more about the herbal treatment, about whether a naturopathic approach addresses inflammation as well as clear infection.
Yes. Yeah, absolutely. Inflammation is the breeding ground for infection. So if that's not addressed, especially within the urinary tract, then we're just going to potentially see a resistance to treatment, or treatment failure, or recurrence. And of course, that inflammation can come from many different parts of the body, whether it's the gut or the fact that their adrenals are under stress and they aren't able to support that system, because our cortisol actually is a wonderful anti-inflammatory when we have enough of it, right? So there are that has to be part of a treatment plan always, in order to help patients get well. A good example was, I had a patient who after every time having intercourse, they would get an infection. And I know that's going to resonate with a lot of patients.
So many.
And the first treatment plan that we created was more targeted on a chronic infection, and that treatment did not resolve her issue. She still developed an acute UTI after after she had intercourse again. And then we moved to focusing on inflammation, and she's unfortunately someone I've lost to follow up, but last I heard, she was able to have intercourse 5 times before she had an infection. So that was, so obviously, pardon me?
It's a big improvement.
It's a big improvement. It's not perfect, but at least we were making progress.